Hey guys, Dr. Ryan here at Precision Care Medical. Today I want to introduce you to our Trident GTS traction table. This is a really interesting piece of equipment that we have here. We use it for back pain and neck pain. Just a quick thing about traction or spinal decompression as it's known. You have your spine, and throughout the day and sometimes throughout life, your vertebrae, they take a great amount of load just from gravity or your everyday tear. And what this table will actually do is it's allowing the spine to decompress. So you can take these vertebrae and you could actually distract them or pull them apart a little bit to give your muscles a break, decreases muscle spasms, to also release the nerve. We have two types of traction available to us. We have lumbar traction, as I previously discussed. We also have cervical traction. Cervical traction acts just the same way. The patient is laying on the table. Once we have it set up, it also is able to decompress the neck or the cervical spine, giving patients with radiculopathy, neck pain, tension, a great amount of relief. Here we have Val Klitschnikov. He's a trainer here at Matchpoint. He volunteered himself to be a model in our demonstration video. I just want to show you guys how we strap a person into this table to set up for lumbar traction. So once the patient lays down, what we like to do is we put this belt around their waist. And it shouldn't be tight, it should just be nice and snug, so it's really painless. We work with patients. We don't want to make anybody uncomfortable here, or if anybody's claustrophobic or feels a sense of tightness. And we just take this belt and we kind of cross it in. So it's not tight, but it's snug, right, Val? Yeah? Perfect. And then the next part is just the chest strap. So we just put it over someone's chest, just like so. And again, it's just snug. It doesn't have to be tight. It doesn't have to be uncomfortable. We then insert our support here for the patient's arms. And at this point, the patient's all secure. There's a component to the belt which clicks into the centerpiece. And at this point, this is all the patient has to do to start the traction process. The next piece here is a rope release. We attach it to our waist belt. And we just supply a little support under the patient's legs. Perfect. So this is the final resting position for lumbar traction. The next thing, we just turn the machine on, and it's a 15-minute treatment of decompression. The way we start the treatment is we assess the patient's body weight, and we generally start with half their body weight till we find that comfortable level. As a safety precaution, every time a patient is placed in traction, whether it's lumbar or cervical, we hand them the kill switch. So we tell the patient if they're experiencing any kind of pain, numbness, dizziness, just push the button and the machine will automatically stop. After the patient's set up in the machine, it's just a matter of putting in the data and the parameters for the traction table, and the pull already started. So in this case, we're using half his body weight, and the traction meter is indicating how the machine is working. Now the table is distracting or pulling apart. At this point, we're almost at the end of the 90 pounds, and this is 90 pounds of force. And the most important thing about it is it's safe. You're here and you're monitored by a doctor.